CHÉOS exists to improve health outcomes for BC, Canada, and the world. Learn more at chaos.ubc.ca.
My name is Amy Salmon. I am the Associate Director at CHÉOS, and it is my great pleasure today to introduce our speakers, who are Drs. Anna Gadermann, Kimberly Thomson, and Monique Gagné Petteni. So Dr. Gadermann is an assistant professor at the Human Early Learning Partnership at the School of Population and Public Health at UBC and a scientist at CHÉOS. Dr. Gadermann's research focuses on the social determinants of mental health and well-being in children and youth using large-scale linked data sets, including student and teacher-reported survey data, as well as administrative, health, and education data. Dr. Thomson is a postdoctoral fellow, also at the Human Early Learning Partnership, and her research investigates how social determinants within young people's early environments are associated with future mental health and well-being throughout the life course and into the next generation. And Dr. Petteni is a research associate at the Human Early Learning Partnership, as well as the data access lead at Population Data BC. Her expertise is in leveraging longitudinal, population-based, linked administrative data sets to better understand children's academic, social, and emotional outcomes over time. Before I turn the session over to Drs. Gadermann, Thomson, and Petteni, I also wish to acknowledge with gratitude that our work today is taking place on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. And with that, I'm pleased to turn it over to Dr. Gadermann and team.
Thank you so much for the kind introduction, Amy, and wonderful to be here. Thank you for the invitation and to see some of you I haven't seen in a long time. So it's a really nice way to connect as well. So I will start screen sharing now, and please let me know if there are any issues with seeing it. Can you someone give me a thumbs up? Good. Okay, perfect. So as Amy said, our presentation today is about the mental health impacts of the COVID-19 pandemic on students, parents, and teachers. And these studies are part of a larger team collaboration over the past 1.5 years addressing the impacts of the pandemic. And thank you so much for being here today. And we hope for a lively discussion and feedback and future implications and directions. So I will pass it on to Kim now. Thank you.
Great, thanks, Anna. And thank you everyone for the warm welcome. We also just wanted to start today by expressing our gratitude for being able to conduct this work on the traditional, ancestral, and unceded territory of the Musqueam Nation. This was conducted at the UBC Vancouver campus. Thanks, Anna. So today we'll be presenting findings from 3 interrelated studies examining the mental health impacts of the COVID-19 pandemic from multiple perspectives. So first we'll present findings from a multi-round national online survey of parents in Canada who were living with children at home. Second, we'll present findings from a study of grade 8 students' perspectives using data collected from a school-based survey conducted in a BC school district last February. And finally, we'll be presenting findings from a study of teachers' experiences during the pandemic from a provincial online survey conducted in February 2021. Thank you. So this is an infographic that was popularized in the early days of the pandemic in April 2020. It identified mental health as the 4th wave of the pandemic and suggested that mental health might have the largest and most enduring population health impacts of the COVID-19 crisis. And in particular, there was concern about population subgroups that may be particularly vulnerable to mental health impacts. These included essential workers, people with pre-existing mental health conditions, older adults, as well as the youngest members of our society, developing children, and people with fewer social and structural resources. Another group that were identified at particular risk of mental health impacts were parents with children living at home. And throughout Canada, the pandemic has posed challenges for families through social isolation, school and childcare closures, the transition to working from home, and on top of that, financial and employment insecurity. And as well as the direct effects of these stressors on parents' mental health, the other point of concern has been the potential impact of these changes on the home environment, affecting children's mental health and their development. So to study these impacts, our team conducted a survey of adults living in Canada to address 3 questions. The first is, how is the COVID-19 pandemic associated with mental health changes among parents and children? And are there differences according to sociodemographic subgroups? Second, how has the home environment changed due to the pandemic? And third, what are the factors that support family mental health during this time? So data were collected using an online survey distributed by polling vendor Mary Matchbox over 3 survey rounds. And each round, our survey was completed by a survey of 3,000 adults that were representative of the population of Canada by age, gender, region, and household income. And you'll see the sample size just indicated here at each study round. And this was a subset of adults who identified as parents with children under the age of 18 living with them at home. So round 1 was conducted in May 2020 and coincided with the first reopening phase in many Canadian provinces and territories, which was after about 2 months of school and workplace closures. This was also a time when we knew the least about the COVID-19 virus, and case numbers were increasing daily. Round 2 was conducted in September and coincided with the first return to school after the previous closures, and 2 months of summer holidays. And this coincided with actually a relatively low period in new daily COVID-19 cases. And round 3 was conducted in January 2021. This coincided with a return to school after 2 weeks of winter holidays and coincided with the highest yet observed peak in new daily cases. And of course, each of these survey rounds took place before we had widespread vaccine coverage. So our survey items were informed by a longitudinal survey first conducted by the UK Mental Health Foundation. And one advantage of this research was that the survey was developed in consultation with people with lived experience of mental health conditions. And for our analyses, we used descriptive statistics as well as chi-square and logistic regression analyses to compare mental health outcomes in 3 ways: between parents and the rest of the sample, within the subgroup of parents, and across survey round. So what you're seeing here is a graph of our 4 main outcome measures of interest. And these included self-reported worsened mental health, not coping well, increased alcohol use, and suicidal thoughts and feelings. And this graph from the first study round in May 2020 shows parents in blue and the rest of the sample in gray. So the rest of the sample were other adults who did not have children living at home with them. And what we found is that a greater proportion of parents compared to the rest of the sample reported worse mental health due to the COVID-19 pandemic on all measures except for not coping well in round 1. And in September 2020 and January 2021, these are the graphs for round 2 and round 3, we saw that as the pandemic progressed, a greater proportion of parents compared to the rest of the sample were still reporting increased alcohol use during the pandemic. We saw that a similarly high proportion of parents were reporting worsened mental health and suicidal thoughts. This was similar to round 1. However, this was no longer statistically significantly different from the rest of the sample, who were also reporting these outcomes at a higher proportion. And finally, a greater proportion of parents compared to the rest of the sample reported not coping well in these 2 later survey rounds. So that was a difference again compared to round 1. So we were also interested in what are the types of stressors that parents report facing during the pandemic. And what we found is that parents with children under age 18 living at home compared to the rest of the sample, again, were more likely to report pandemic-related stress. This is in regards to financial concerns, worries about their existing mental health problems becoming worse, relationship challenges, and worries about domestic violence. Parents also reported unique stressors not experienced by the rest of the sample, including worries about looking after their children while continuing to work, and worries about their children contracting the COVID-19 virus at school or childcare. And concerns about virus exposure were higher at the first return to school last September compared to the return to school last January. So our next interest was to examine disparities in mental health within the parent subsample. And this table presents the results from our logistic regression analysis with the predictor variables highlighted here, as well as the corresponding odds ratios. And after adjusting for study round, we found that parents who are younger, so those under age 35, parents with pre-existing mental health conditions, and parents with disabilities had higher odds of mental health outcomes, including perceived worsened mental health, not coping well, increased alcohol use, and suicidal thoughts and feelings. Parents who reported financial concerns, relationship challenges, and worries about looking after their children while continuing to work also had higher odds of these mental health outcomes, and in addition were more likely to perceive that their children's mental health had worsened during the pandemic. And then when we looked at this across study round, we did not observe significant changes in these disparities over time. So the proportions of parents reporting worsened mental health remained stable and unequal between these parent subgroups. So this relates to our second objective, which was to examine how the home environment had changed during the pandemic. And for this next part of the study, we asked parents to report on changes in their relationships with their children. We found that parents who reported pandemic-related financial concerns, relationship challenges, and stress looking after their children while working had higher odds of negative interactions with their children, and this included increased conflicts, discipline, use of harsh words, and shouting. And these differences remained after adjusting for differences in parent age, gender, pre-existing mental health conditions, disability, and study round. So on the positive side, our study also showed that parents who reported these pandemic-related stressors reported higher odds of positive interactions with their children, including increased quality time, feeling close, showing love and affection, and observing resilience in their children. And these findings support earlier suggestions that increased time, overall time with family members, might create the conditions that increase both negative and positive interactions. So finally, our third objective was to investigate what had helped parents cope with stress during the pandemic. And across the study period, the most frequently reported strategies included exercise and connecting with friends and family. And other research has similarly identified the maintenance of family routines, adaptability, and family cohesion as factors promoting family resilience during the pandemic. The limitations of this research included this being a cross-sectional study, so we can't determine if exposures and outcomes were causally related, only that they were associated. For most of our outcome measures, these were single-item self-report measures of mental health. We did not use clinical or subclinical screening measures, which would be an important direction for future research. Participants completed the survey online, which may have introduced sampling bias, although strategies were used in the data collection to minimize technology barriers. And finally, a limitation of this study was that our only measure of child mental health was parent reported. And it was very important to us to also understand the pandemic from the perspectives of children themselves. So this was inspiration for our study with children that Anna will speak to shortly. So we just had two takeaway messages from this parent study. First is that parents with children under the age of 18 years old living with them at home are a population at heightened risk of deteriorated mental health due to the pandemic. Second, our data also suggests that population-level responses are required to adequately respond to families' needs and mitigate that potential for widening sociodemographic disparities. So supports, for example, such as affordable childcare, improved internet access to complete school and work from home, as well as accessible and timely financial supports, are all examples of interventions that could directly benefit families now and also beyond the pandemic. And just to wrap up this particular study, we wanted to acknowledge the participants that took this survey, as well as our partners, the Canadian Mental Health Association of BC. And we also wanted to recognize the additional members of our research team, including Emily Jenkins, Chris Richardson, Corey McAuliffe, Randeep Gill, and Saima Harani. And Anna, over to you.
Thank you. Can you hear me? Perfect. Thanks so much. So I will start the second part or the second study now, which focuses on the student perspective about the impacts of the pandemic. And this was collected with the Middle Years Development Instrument in one specific BC school district in Coquitlam. So the MDI is the Middle Years Development, the acronym is the MDI, just that you know, you will see this quite a bit. So just in terms of background, the pandemic has been associated with profound changes to student social worlds, including school closures, physical distancing measures within schools upon reopening, and cancellation of in-person social activities. And so research worldwide has documented declines in children and adolescents' well-being and mental health due to the COVID-19 pandemic. For example, a systematic review by UNICEF showed that there were higher levels of depression, anxiety, conduct disorder, and less physically active behaviors reported in children and adolescents during the pandemic compared to pre-pandemic levels. Specific to Canada, a previous study found that students ages 10 to 12 reported worsened depression, anxiety, irritability. However, at the same time, a proportion of children, 9% to 13%, also reported improvements in mental health. So there's a range of mental health outcomes. So for us, the research question for this study was, how is the mental health and well-being of BC students? What contextual factors promote resilience? And how in general are the school experiences during the pandemic from the student perspective? And this study is based on close collaborations with stakeholders in the schools, communities, and government. So with a clear approach and goal to have implications for the schools and communities. So as I said, it's the Middle Years Development Instrument. The MDI was used to collect data. This is a self-report survey that is used for children in grades 4 to 8, administered in various school districts in BC and also in other jurisdictions. The MDI was developed through a collaborative approach with researchers, teachers, children, and community members. And previous research has provided validity evidence of the MDI for these age groups. Students complete the MDI during class time under teacher supervision. And these are the main dimensions that are measured by the MDI. So you see here, can you see my mouse? Yeah, perfect, thank you. So you see the social emotional development. So students respond to questions about the current social and emotional functioning in 7 areas. So we have optimism, self-esteem, happiness, empathy, pro-social behavior, sadness, and worries. I mean, it's an indication of mental health and well-being more generally. Then we have the physical health and well-being domain. Students evaluate their physical well-being in the areas of overall health, physical activity, nutrition, and sleeping habits. Another domain is connectedness. This focuses on connectedness with adults in their schools and neighborhoods, with the parents or guardians at home, as well as with their peers. Then we have school experiences, and students are asked about their school experiences in multiple areas, including academic self-concept, school climate, and school belonging. And finally, we have the use of after-school time domain. In this domain, students are asked about the time they spend engaged in organized activities, such as sports, music, and art, as well as the time they spend in unstructured activities, such as watching TV or doing homework or playing video games. Using some of this data, a Wellbeing Index is created. This is also used to bring back the information to stakeholders. And for the purpose of this presentation, we focus on data from the Coquitlam School District, because one of the, I mean, this was not planned, but one of the advantages was that the first time in Coquitlam related to pandemic, the data was collected in January to March 2020 in grade 7, so just prior before the pandemic was declared, as well as in January to March of 2021, so approximately 11 months into the pandemic. At both time points, students were attending school in person, and data were collected in 40 middle schools in Coquitlam. And at each time, the participation rate of the district's grade 8 public school population was over 80%. So this is a very large proportion of those students in public schools in the school district. Of note, about 80% of the participants who participated in grade 8 were also participating in grade 7. So we were able to link it from pre-pandemic to during pandemic data collection. And this is this index is used to show the thriving, the percentage of children thriving. Thriving here, as you can see here, is a combination of measures of optimism, happiness, self-esteem, absence of sadness, and general health. And when you look at these two pie charts, so you see in 2021, we see that 47% of the students report a low proportion of thriving compared to 39%, and a higher proportion of grade 8 students reported low well-being as well compared to 2020. So there's clearly is a trend for a decline in mental health, although it has to be acknowledged that generally in terms of developmental periods, there's often a decline in well-being between grade 7 to 8, just in terms of developmental transitional period. But it could well be that confronting new stresses associated with early adolescence in the context of the pandemic may have contributed to further declines in well-being during this year. Another index that is provided is the asset index. Assets are positive experiences, relationships, or behaviors that are present in children's lives. And these are considered actionable, meaning that schools or communities can focus their efforts in these areas to create contexts where children can thrive. And so we have these 4 aspects of the assets. So we have the adult relationships, referring to adults at school, neighborhood, and home. We have the peer relationships about peer belonging and friendship intimacy. We have nutrition and sleep, focusing on eating breakfast, meals with adults in their family, and frequency of good sleep, as well as the after-school activities. These would be the organized activities that children participate in after school. So when you compare these two asset indices, you can see that compared to grade 7 in 2020, the proportion of students reporting each of the 4 MDI assets has declined. And this was especially seen for the after-school activities, so 72% compared to 85%. To look further into the organized after-school activities, we see that 61% of students reported participating twice or more a week in 2021, compared to 77% in 2020, and also 28% reported not participating in any organized activity in 2021, compared to 15% in 2020. So there are some very clear changes. And if you're interested, you can also look at the specific types of activities listed here. And all of this information is also available in reports. We're happy to share the links for some of these reports if you would like to look at this in more detail. Another way to look at the after-school activities is to look at the distribution reported by the students within the school district by the neighborhoods. So this is School District 43, Coquitlam. And you can see these are the different neighborhoods. I don't know if anyone is familiar with Coquitlam, but these are the neighborhoods. And we have information by the postal code of the students. So we can map their assets or their well-being or the various indices on the neighborhoods. So what you can see here that there's some variability in the present of the after-school activity asset. And so the after-school asset is considered present if children participated in at least one activity after school. And the darkness of the brown here, we also call it the richness of the soil, indicated the percentage of children who report the presence of the after-school activity asset. And so you can clearly see there is some variability. Hillcrest reported, students in Hillcrest reported 91% the presence of asset, and 77% of the students in downtown Port Coquitlam reported the presence of the asset. So this was in 2020, so prior to the pandemic, and you can see the difference when you look at the following year, so 2021 during the pandemic, compared to the prior year. You can see that the neighborhood with the highest percentage of the reported asset, Hillcrest, decreased from 91% to 80%, and I'm not sure if I pronounce it correctly, but Maillardville decreased from 84 to 62. So you can see very clearly in the different neighborhoods the decrease. And this is very helpful to communicate findings to stakeholders and find ways of supporting communities. In terms of unstructured activities, so this is focusing on computer use and TV, we find that children reported spending more time online or on screens during the pandemic. For example, in 2021, 35% of students reported spending 2 or more hours playing video or computer games, compared to 23% in the prior year. And with regard to Netflix, watching TV, Netflix, or YouTube, 46 reported 2 or more hours compared to 34 in the prior year, which may not be surprising to many of you, but still important to know. And then in terms of connecting with others, we were also interested in if there's different ways of socializing during the pandemic. So with regard to connecting or socializing with their friend in person or remotely, students reported less time socializing with friends in person during the pandemic. So 50% reported never hanging out with friends in person compared to 29% prior. At the same time, they reported more connecting and using the phone or internet to text or chat with friends. So we were interested in finding out more about the specific experiences during the pandemic. So to the general MDI questionnaire, we added a COVID module that has some survey questions regarding experiences during the pandemic. And these were adapted from existing validated surveys, and students and stakeholder provided input. And if you're interested, you can see the items at this website. So the sample of grade 8 students, again, this is also in core curriculum. It was added to the core curriculum data collection. And the total sample was 2,038, 51% identified as male, 47% identified as female, 3% in another way, and the mean age was 14. And the question that was very specific to the impact of the pandemic, during the past 2 weeks, how worried have you been about your mental or emotional health being influenced by the pandemic? You can see that quite a large proportion responded very or extremely, so 17%, 37% not at all, as well as there was a proportion of students who reported slightly or somewhat. We also asked students, what are some of the coping mechanisms that helped you to deal with worries and stress related to the pandemic? And activities that help students cope with the worries and stress included connecting with friends and family, either in person or virtually, engaging in activities such as spending time outdoors, exercising, or spending time with pets. Many of you may have heard that pets has been a big thing during the pandemic, so we definitely see this with the students as well. In terms of changes in social connection, despite the challenges of the pandemic, the majority of students indicated that their relationships with parents or other adults at home and with friends stayed about the same compared to before the pandemic. So 50% for adults at home, 38% with friends, or improved. So 34% with adults at home and 46% with friends. Regarding the relationship with teachers or other adults at school, most students, so 71%, reported their relationship stayed about the same. And this, I think, is interesting too, because Monique will talk about the teacher perspective. So maybe keep in mind that this is a large proportion of students who reported that they stayed the same. A smaller proportion of students reported that their relationships got worse with parents or other adults at home. So this would be 16%, with friends also 16%, and with teachers at school 10%. Then the next question was about how did they spend, how was time spent from before the pandemic to now? What were the differences? So compared to before the pandemic, most students reported spending less time with friends in person, which also relates to the previous discussion about the after-school activities. Students also reported spending more time with their friends online and with their family members in the home. 32% of the students indicated spending more time outdoors during the pandemic in comparison before, but 35% also reported less time outdoors. Another question asked about engaging in COVID-related safety behaviors during the pandemic. This was a particular interest of our stakeholders. And the question was, how easy or hard is it to do the following behaviors at your school? Wear a mask, practice physical distancing, wash hands or use hand sanitizer more often, stay home when sick, and avoid big groups. And what would you guess? I mean, I don't really see the chat, but maybe one person can say something if they feel comfortable. What would you guess? Would it be hard or easy, or what would you expect based on maybe some of you have experience with students that age? Can you say again? Sorry.
I think I heard somebody say hard, but I'm not sure.
Yes, yeah, okay. So we were a bit surprised about some of these responses. And again, there will be different subgroups of children, of course, but a large proportion of students actually reported that it was a little or very easy to wash hands or use hand sanitizer. So, if you look at it, wash hand sanitizer was very high. Stay home when sick was also a little easy or very easy. Wear a mask, which we would not have expected to this extent. 71% responded very easy, another 12% a little easy. And comparatively, a smaller proportion of students reported that it was a little or very easy to avoid big groups or practice physical distancing. And this was before I guess it was during the mandate of wearing masks already for this age group. So another question was, how often do the COVID safety measures at school make you feel safe from getting COVID? And this, of course, is also a really important question to think about, with all these measures that are in place, how do they feel about it in terms of not contracting COVID? So while the majority of students reported feeling always safe or safe most of the time, we had 26% of students reporting feeling safe some of the time, and 8% of students reported feeling never safe from getting COVID at school. So just to give you the number, so that's about 170 students reporting never feeling safe, and about 550 students reporting feeling safe some of the time. And during Omicron, this is probably very different even. So, I think it's something to be concerned about. Another question was about school activities they may be missing. So what do you miss most at school during the pandemic? Field trips came up very frequently. This is again a question that the stakeholders were especially interested in. Class parties, school sports club. And then we also had open-ended responses, so they could also add other options that they were missing. And some of these things were being able to see other friends and hug them during recess or lunch, being able to freely walk around the school with anyone. We also looked at associations between relationship changes and these well-being outcomes. And we did find improvements in relationship with adults at home, with adults at school, and improvements in relationship with peers that were all correlated with higher optimism and life satisfaction and lower sadness and worries. And higher worries about one's mental health was associated with lower optimism and life satisfaction, higher sadness and worries. So something you would also expect in terms of the direction. Finally, we also asked if there may have been some positive changes that students experienced. And so you can see that some students reported that there were no positive changes, so 21%, but some students also reported positive changes. And the most frequently mentioned changes were having more time to yourself, exploring other interests, and spending more time with family members. And I thought it was also interesting about getting more sleep. So, different things that have changed in a positive way. Limitation is that we couldn't really look at subgroups. We would have liked to look at further factors such as household income and employment situation, pre-existing physical and mental health conditions of students and family members. There's a limited generalizability to other contexts, for example, to more rural areas. And there's a general decline of mental health for this age versus whether it's due to the pandemic. So in terms of the implications, really this underlines the importance of supportive social relationships. It identified some of the coping strategies that students found helpful to deal with the pandemic-related stress. It was important to get the students' perceptions in general about their health and well-being, but also how it was for them to engage in COVID-related safety behaviors, to hear from them about things they missed in school. And in terms of future directions, we would like to do linkage to other data sets to examine subgroup differences. We would like to acknowledge the students who took time to complete the survey, and the teachers, students, education staff, and school district administrators who offered the guidance on the original survey content. And we also would like to thank our team, our larger research team, Randeep Gill, Kimberly Thomson, Michael Warren, Martin Kuhn, and Eva Oberle. And I will pass it on to Monique. Thank you.
Thanks very much, Anna. So I'm going to talk about part 3 of this work. And, we saw part 3 is really absolutely essential to this piece. And that is understanding the impacts of the pandemic on teacher well-being in BC. So the purpose of the study was really to gain a greater understanding of teachers' self-identified challenges and supports over the course of the pandemic and how they were associated with teacher well-being. So what I'm going to present today is essentially just the findings that we pulled together for a rapid response report. And you'll see it's very much descriptive in nature and tries to paint a picture really of teacher well-being at that point in the pandemic. So I'm going to talk about key findings related to a few things. Mostly teachers reported current mental health and well-being in comparison to before the pandemic. Opportunities to connect. So that's with students, parents and caregivers, colleagues, etc. Perceived support from different sources at work, meeting the needs of their students, and then also various work experiences that are sort of unique to the COVID-19 pandemic. Can go next, Anna. Thanks. So in terms of the design, it was a survey. It was a survey-based study. It was cross-sectional in nature, and we conducted it in partnership. I think Anna mentioned this already, but with the BC Ministry of Education and also the BC Teachers Federation. And so these are stakeholders that were involved very early on in this, this study, which was great. The survey was conducted online in February of last year, and this was just prior to the third wave of the pandemic. Survey invitations were distributed by the BCTF, and these were sent to a random sample of 7,000 actively employed BCTF members. These are public school teachers. So we heard back from 1,206 teachers from across BC. Just over half of them were elementary school teachers. Another good portion were secondary school teachers, and then others were middle school, etc. Most of them were full-time teachers. On average, they reported just over 15 years of teaching experience, and the majority of the respondents were female, which is sort of in line with the BC teaching demographic generally. And most respondents were between the ages of 35 and 54. I think the range was 24 up until 66 or something along those lines. Okay, so the first finding that we present in this report is really just talking about a pattern of declining mental health that the teachers reported. So what we did was ask them to report on their mental health now in comparison to before the COVID-19 pandemic. And the majority of teachers reported that their mental health was slightly or significantly worse now. So again, now being Feb 2021. What you see also in this table on the right-hand side in the grayed out area, we've just added this in, and it's just a comparison to the same question being asked to a nationally representative sample of Canadians the month prior. So 1 month prior, but this is just the overall population. And we put this in here just because it's an interesting contrast to what we found. And you can see that if you look at the overall sample there, they reported half the, I should say, double the teachers in our sample reported that slightly or significantly worse mental health. So that was fairly striking for us. Thanks, Anna. Okay, so this is a similar question, but now what we've done is asked about mental distress, psychological distress, and this was a scale. So it was a series of questions, and we asked teachers things like, during the past 30 days, how often did you feel so sad nothing could cheer you up, nervous, restless, etc. And so the majority of teachers met the range for moderate mental distress, 56%, and serious mental distress. So again, that was fairly striking for us. And we did also include here, again, on the right-hand side, a couple of studies that use the same scale, just for contrast. And if you look at the farthest right column there, you can see a sample of Canadian teachers who were asked the similar same questions and the same scale in 2014. And again, about half of them responded in such a way that they had serious mental distress. So again, that was fairly striking for us. And again, not perfectly comparable, given that we're not looking at exactly the same demographic, but just a good contrast to keep in mind. Okay, so throughout, what we did was ask teachers to provide commentary on as they were filling out the survey, and we did get some a lot of qualitative responses. And I'm just going to highlight a few of them because they do sort of paint a picture for you as well. So this is a couple of different teachers who commented, and I think it illustrates the past two slides pretty well. So this one teacher, this has been the hardest year of my teaching career. The other teacher, myself and my colleagues all feel the weight of the pandemic and are exhausted. So lots of comments of that nature, and I've peppered them throughout here. So you'll see a few more. Okay, so the second piece, which was a pattern that sort of emerged from our questions, and this is just fewer opportunities for teachers to connect. So teachers were asked about their opportunities to connect with students, with parents and caregivers, with colleagues, and also just to feel connected to the school community in general. And the majority of teachers, 69%, reported fewer opportunities to connect with students. 78% reported fewer opportunities to connect with parents and caregivers. The vast majority reported fewer opportunities to connect with colleagues. And again, the vast majority reported fewer opportunities to really feel a part of a school community. So again, I've highlighted one of the teachers who illustrates this. I miss hugging and receiving hugs of support from my colleagues. I miss the teaching staff who being able to eat lunch together at our long table. I feel more isolated this year. So, that really illustrates the point there. The third piece that we highlight in this report is just basically feeling supported and how that might be related to teacher well-being. So the first thing we asked teachers was, how did these various supports, which you see listed here, to what extent do you feel like they've supported your mental health and well-being over the course of the pandemic? And so you've got the 7 there, so you can see from the bottom right to the bottom left to the right-hand side, we asked them about principals and school-based administrator support, school board support, Ministry of Education, union, colleague support, and then also just sort of a general support from being recognized within the school and also recognized generally within the community. Teachers, you can see here, the scale isn't listed necessarily properly on the left-hand side, but 5 here is students who are feeling, reports of, I can't actually see the bottom of my screen, but I believe it says completely agree or completely supported, and then the bottom is the negative, not supported, and 3 is neither, just sort of more neutral. My apologies. I can put that into the chat after what the actual scale is. So some teachers reported feeling more support from their colleagues, principals, and school-based administrators and unions. So that teachers generally reported more support in those from those sources. And then generally reported feeling less support from school board, Ministry of Education, and less recognition from school and the general community. Thanks, Anna. Thanks, Kim, for putting that in the chat. Okay, so the next thing we wanted to do was just try to associate those feelings of support or those reports of support across those 7 sources to reports of well-being. And we found that each of them were significantly associated with teachers' well-being. So positively associated with general health, quality of life, job-related affect, and mental health. And negatively associated with mental distress and turnover attentions. Okay, so just here an illustration again of this relationship. So my district kept telling me that I come first and my mental health is important. This has enabled me to give myself permission to leave work a bit earlier and go for a run before I come home to take care of my family, and has helped my mental health. So just a bit of an illustration of how those supports might help teachers' well-being. Okay, and the other thing we looked at was turnover intentions and social support. So turnover intentions here just means your likelihood to seek to leave the profession. So what you see in figure 4 here is the percentage of teachers who are more likely to seek to leave the profession compared to before the pandemic, based on the number of sources of support they reported. So in the bottom right corner of that figure, what you can see is these are the teachers who reported, felt supported by all 7 of those sources of support that I talked about earlier. So from school district, Ministry of Education, principals, et cetera. So those teachers, as you can see, have the lowest percentage likelihood to leave the profession, and it goes all the way up in a nice gradient there in terms of those from low to high supports. So that was interesting for us. Sorry, Anna, yeah, you can. The next piece we looked at here was unmet needs for students. So we asked teachers to basically give us a sense of the extent to which they thought that they were meeting or able to meet students' academic needs in this school year, their social emotional needs, and also meet the needs of students with diverse abilities. So this was interesting. The majority of teachers reported that students' academic needs were being moderately, very much, or completely met. 18% did feel that they were slightly or not at all meeting students' academic needs. In contrast to that, however, 42.8% of teachers reported students' social emotional needs were slightly or not at all met this school year. And another 43.5% felt that social emotional needs were only moderately being met. Nearly half of teachers reported feeling the needs were slightly or not at all met for students with disabilities or diverse abilities this year. So we did find that quite striking. Okay, and just another illustration from a teacher here. There are far more students struggling with anxiety and mental health, and we're struggling to provide enough support, which creates even more stress and anxiety for teachers because we feel we are not supporting our students to the best of our ability. So just the complexities there. Okay, so the other thing we asked about was whether or not teachers felt that they were meeting the needs of students or able to meet the needs of students from vulnerable backgrounds. So students who are marginalized, structurally vulnerable, or students who are experiencing adversities. And 31% of teachers felt that their school was only slightly or not able to meet the needs of students from marginalized or structurally vulnerable backgrounds. Again, illustrating this to some degree, one of the teachers highlighted, my students desperately need the breakfast program and a hot lunch. Food security is huge, and I have students who are extremely hungry. Okay, and then the last piece that we looked at was just sort of a few unique work experiences during the COVID-19 pandemic, maybe not so unique. The first one is workload, and we asked teachers, compared to before the pandemic, how was their workload? And the majority of teachers, 67%, reported that their workload was more or a lot more than before the pandemic. I don't know if that's very surprising to anyone. Again, one of the teachers highlights here, having to implement programs and support for remote students while simultaneously supporting in-person students has increased workload tremendously. And then finally, the last piece that we looked at was just understanding the difficulty in implementing safety measures at school. And you can see here, we looked at a few different things. We asked teachers about masks, physical distancing, washing hands, having students stay home and avoid gatherings. And teachers generally reported that the COVID safety measures were somewhat easy or neither hard nor easy to implement, with the exception of physical distancing, which teachers generally reported to be somewhat hard or very hard. And this sort of jives nicely actually with what the students were reporting, if you remember how Anna was talking about it in her, with the MDI numbers. So that's interesting that does sort of jive nicely, the teacher and the student reports there. So what have we learned? Again, this is presenting an overarching picture of the experience of BC teachers 11 months after the onset of the COVID-19 pandemic. As I mentioned, teachers reported declines in their mental health and fewer opportunities to connect with students, families, and colleagues. A large proportion of teachers reported that student needs were not being met this year, particularly as we saw the social emotional needs and for students with diverse abilities. Teachers reported challenging work situations such as increased workload and difficulty implementing the physical distancing as a COVID-19 safety measure. On the positive front, we found evidence that feeling supported was positively associated with factors such as general health and quality of life, and negatively associated with factors such as mental distress and turnover intentions. So that piece is important as well. In terms of limitations, as I mentioned, the results that we presented here and that are in the report are very much descriptive in nature, and so we need to interpret them with care for that reason. In the cases where we do present associations, as I think Anna and Kim both mentioned, it's important to note that these do not provide information about causal relationships. Participants in the research were self-selecting, so we have to remember this is a self-selecting group of teachers and it may not be representative of all teachers in BC, and that's important to note. And where do we go from here? The first piece that's important to us is the knowledge translation piece. So the findings presented in the report are definitely targeted towards top policymakers and other stakeholders tasked with making decisions to help support teachers. And that work's ongoing, and I mean, is sort of embedded in the design of the study, in that the stakeholders were included in this from the get-go. The other piece that is of interest to us are just the temporal trends over the course of the pandemic. And you can see with some of the other work with the MDI, we were able to look at that to some degree. Our findings for the teacher component here present experiences 11 months into the COVID-19 pandemic. So we have to remember that piece. 1 year on, how would the outcomes compare? That is a huge question of interest for us moving forward. And acknowledgement. So again, just wanted to very much thank our partners at the BC Ministry of Education, Jeremy Higgs and Nicole Gardner, the research division with BCTF, and of course the teachers who did in the pandemic, with all they've got going on, took the time to complete the survey, and were able to offer guidance as well on the original survey content. We thank the rest of the research team, including us here, Michael Warren, Kim Schorner-Reichel, Tanya Molyneux, Martin Kuhn, and Eve Oberle. And of course, we would just like to absolutely acknowledge and thank all the teachers and those working with children and youth in schools and the community throughout the COVID-19 pandemic. And as we said in the report, we do see you and we deeply appreciate all of the work that you've done.